Mr. Montague, Mr. Morrison, Mrs. Nita Garvey, Mr. Paulwell, Mr. Phillips, Dr. Phillips, Mr. Robertson, Mr. Robinson, Mr. Siblist, Mr. Slowly, Mr. Vaz, Mrs. Vaz, Dr. Wheatley, Mr. Williams, Mr. Wilson, Mr. Wright, Mr. Chin, Mr. Williams.
Members, just before we start the sitting of the House, may I use this opportunity to welcome all those persons joining us in the gallery today. We welcome you heartily, and I want to welcome also all those persons who I'm sure joining us online, particularly our students. I see no students in the gallery today, but I know that very often the teachers say that students join us online. We welcome you, and we hope that you will find the sitting an informative one. And of course, today we have the Honorable Dr. Christopher Tufton, who is our Minister of Health, and I'm very sure that all of us are looking forward to the presentation, as health is so important to us all. I also want to use this opportunity this afternoon to welcome to the Houses of Parliament a new face that you probably see sitting directly in front of me here. With us this afternoon, joining the staff to be of assistance, is Miss Colleen Lowe. And she has joined us as the Deputy to the Clerk to the Houses of Parliament. We welcome her and look forward to her support in the Parliament. So we're going to now move on to the agenda. House Leader, you have any? You're fine. All right. Statements by ministers? No. Announcements? Announcements?
Thank you. Laid on the table of the House today are the following: the Customs Tariff Revision Amendment Resolution 2022 under the Customs Act, and Annual Report and Financial Statement of the Transport Authority for the year 2018-2019.
Bills brought from the Senate, petitions, papers, reports from committees, notices of motions given orally, questions.
Madam Speaker, I'll recommit when Dr. Clark is here.
You will.
Notice of motion.
Well, questions and answers to questions. Motions that may be made at the commencement of public business requiring notice. Motions relating to sittings of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business.
Madam Speaker, today it is our intention to continue with the sectoral debate. The Honorable Dr. Christopher Tufton, Member of Parliament, Minister of Health and Wellness, will be our only speaker for today.
Dr. Tufton.
Thank you very much, Madam Speaker. And I appreciate the fact that I'm the only speaker today for many reasons. And in commending you on your stellar leadership as leader in this House, I also want to ask you kindly to extend the similar courtesies that you do to other speakers who have spoken before me.
Dr. Tufton, I can assure you you'll have the courtesies, and I suspect that your comment about being the only speaker means that we must fasten our seatbelts for the ride.
Thank you very much, Madam Speaker. Madam Speaker, today I have tabled in the House 4 documents, which hopefully will momentarily be on the screen, but I'll show, which captures overall holistic synopsis of the state of public health in the country. As you know, Madam Speaker, I like data in arguing positions, in influencing decisions, and the team at the Ministry of Health and Wellness have worked hard to put together COVID at a glance, which looks at the historical overview of COVID, our regular vitals focusing on dengue, really good reading around the history of dengue in Jamaica, including the outbreaks that we have had in recent times and the responses, highlights of our key initiatives, because we can't go through everything. So for those who would like, we can provide that information. And another very important document, which I'll speak to later on, looking at primary health care reform 2021-2030. So I commend for reading to my colleagues and to others. These documents will be stored online. Madam Speaker, this sectoral presentation marks a milestone in my personal career, as well as that of the Ministry of Health and Wellness, which I have had the honor to lead for nearly 7 years. This is the longest, Madam Speaker, that I have served as Minister for a portfolio, having served 2 other ministries. But more importantly, I've been privileged to lead a team of dedicated and competent public health sector workers to steer the response from the most significant health threat in over 100 years. I would like to give God thanks, Madam Speaker, at the start for his many blessings and for his guidance. I would like to thank the health team for their unrelenting dedication and commitment. And I would like to thank our multilateral and bilateral partners, the IDB, the PAHO WHO group, other partners, bilateral partners, local partners, including the private sector, the faith-based organization, and others, who have maintained a strong interest in supporting us, particularly over the last year during this COVID period, and who have been constructive in their criticisms and in their collective efforts. I want to thank the Honourable Prime Minister Andrew Holness for his leadership, Madam Speaker, and my cabinet colleagues and parliamentarians on both sides of this House and in the upper House for their critical support, in particular in response to the COVID pandemic. I'm also thankful to the municipal corporations across the island who, through their network of collaborators, have greatly facilitated the achievement of the health team. Madam Speaker, a big thanks to my colleague, minister and supporter right next door to me here, well, nicely dressed, Julian Cuthbert-Flynn. If there is ever a minister of state to have, particularly in these times, it is this one right here, because I called her name, I did. She has the interest, the commitment, and nobody not fast like her in terms of her attempt at getting things done. So I really want to give her a big up and a thank you for her support. Madam Speaker, to my family, my son Charles, who is here, and to my other family members, I want to express my appreciation to them for their ongoing love and support, something I value and cherish. And last but by no means least, to my constituents who are here, some of them at least, I want to say a big thank you to them for their patience, Madam Speaker. Challenges of COVID has deprived me at times for being present in the constituency, and I know that's not a good thing. And they often say to me, remember, no, the country didn't elect you, we elected you. And they are right, but they have remained supportive, and I appreciate that, and I want to recognize them, my management team and the others. Indeed, Madam Speaker, I believe that one of the commendable features of our COVID-19 response has been the bipartisan support. And in that regard, I want to recognize my opposition counterpart on that side, who we have had several discussions around COVID. And I must say that I have rarely gotten the feeling that the discussions did not have the absolute best interest of the Jamaican people. In fact, I have never gotten that feeling, and I want to recognize it for that. I think it's important, Madam Speaker, as a learning point out of the COVID experience, that we recognize that that unity of purpose is critical to overcoming critical threats. It is a good sign in our politics that it is maturing, and that we are developing the emotional maturity to address critical issues of national importance in the interest of all of Jamaica. I am a strong believer, Madam Speaker, in the capacity of our people to overcome any challenge if we work together, recognizing our collective interests, and that as a country we can be healthy and prosperous if we are prepared to work at it and support each other in achieving this collective goal. Madam Speaker, there have been many challenges over the past year, but COVID remains the dominant challenge during this period. The COVID-19 pandemic impacted our healthcare delivery at all levels, and we attempted to adjust as we went along because there's no narrative, there's no playbook for dealing with this pandemic. We write it as we go along. We saw a decline in service utilization in some areas of the health system. Provisional data in the year 2021 shows that we had 2.987, and I'm rounding the numbers, visits to public health facilities compared to 3.161 million the year before, in 2020. This is a decline of almost 6%. In 2021, there are 1.812 million visits to our health centers compared to 1.835 in 2020. This represents a 1% decline over 2020 figures. We had 764,000 visits to public hospitals when compared to 941,000 a year earlier, representing a 19% decline over 2020 figures and a 36% decline over the 5-year period of approximately 1.189 million. This decrease, Madam Speaker, in hospital visits again was due to adjustments we had to make, particularly as it relates to outpatient care in our health center clinics in the hospitals. It is important to note, Madam Speaker, that total surgical operations increased in 2021 to approximately 55,400 compared to 52,115 in 2020. However, it was less than the 5-year average between 2016 and 2020 of some 71,000 surgical procedures, which means, Madam Speaker, an approximate 16,000 less surgeries based on the 5-year average when compared year over year. Madam Speaker, but the team worked hard. We provided 297,000 diagnostic imaging services, including X-rays, CT scans, and MRIs. Over 2.3 million lab tests conducted by the National Public Health Lab in 2021, representing an 18% increase over the year before. The areas of reduction, Madam Speaker, colleagues, came as no surprise to us, but we made strategic changes in our operations to ensure continuity of care for our patients and adequate infection prevention and control measures. The strategic changes we made were many, but I'll mention a few. Use of digital technology for continued care of patients previously seen in hospital outpatient clinics and health centers. Patients were given longer appointments and prescriptions where possible, where we had a record of those patients, when they had to come in, what they needed, and therefore we would sort of treat them in advance and therefore cut the frequency of visits to hospitals. But importantly, and I cite this as an innovation out of COVID that we should continue, we use the crisis of COVID to build a telemedicine and home delivery service to treat our most vulnerable patients. Madam Speaker, through the NHF, we did 191,524 home delivery of prescription drugs between August 2020 and March 2022. In other words, persons ill at home couldn't go out. We put a provision in place to deliver the drugs to them. This is after the doctor having had discussions with them. We also did 13,432 smart locker deliveries between March 2021 and March 22. So, Madam Speaker, out of adversity has come some innovation. And I think this is an important point to learn as we move into the future to build resilience. But, Madam Speaker, while COVID-19 continues to be an immediate threat, we must now shift our singular focus from addressing this threat to building on the opportunities that it potentially represents. And that's where I think our strategic mindset should be collectively placed. Even though we are not being complacent about COVID-19, it is still a clear and present danger. But we must protect ourselves with an appropriate public health response, not just, Madam Speaker, for today's generation, but for generations to come in the future. And, Madam Speaker, as we attempt to build back stronger and more resilient, let us be clear that the discussions on economic growth and development can no longer view healthcare as a cost to the public purse, but instead as an investment in our people for future prosperity. I think COVID should have caught us that. Madam Speaker and colleagues, economic modeling, particularly in a developing country context, must focus on human development. And healthcare is a fundamental determining factor of our productivity and competitiveness as a nation. Too often, we have ignored this fact. Over time, we have seen the manifestations of this in lost man hours and low productivity due to premature sickness, not to mention the pain and suffering experienced by Jamaicans who may have access to health services, but due to a lack of infrastructure or personnel, the quality of that service is compromised. Indeed, COVID-19 has impacted the labor force, Madam Speaker, directly or indirectly. It's either you're sick and can't go to work, or you can't go to work because you are afraid to get sick, whether influenced voluntarily or through restrictions linked to government policy. So, Madam Speaker, I've given 25 years approximately of public service and long enough in public health, almost 7 years, to understand that we are ignoring these issues, or if we ignore these issues, we are ignoring them at our own peril. We must spend more time advocating and making the necessary changes. This, Madam Speaker, is the commitment that I give today in this portfolio under the leadership of the Honourable Andrew Holness, and will continue to do so in this year. In fact, Madam Speaker, I want to say that advocacy will define my own stewardship this year, as long as I'm privileged to hold and honored to hold this position. Encouraging partnerships, but also calling out stakeholders' interests where we believe there can be better attempts at supporting the health and wellness of our population and our national interests for sustainable economic and social development. We will call it as we see it, even if it means offending some who do not agree with us. We will do it respectfully, but nevertheless, we will speak it guided by the science. Madam Speaker, we have a sick profile that is alarming and getting worse, and we all can do more to correct this. A large percentage of Jamaicans have a non-communicable disease or a significant risk factor, such as obesity, high cholesterol, or physical inactivity. Many are unaware, some may not even care. But in the end, Madam Speaker, it affects all of us in the shared burden of healthcare costs. This is something we must speak loud about in order to bring attention to the crisis that is up ahead, which I'll speak to now. Madam Speaker, in 2016-2017, Jamaica Health and Lifestyle Survey indicated that 1 in 3 persons aged 15 years and older were hypertensive, 1 in 8 had diabetes, 1 in 2 was obese or overweight. Approximately 8 out of 10 Jamaicans had low levels of physical activity. These are trends born primarily out of historical lifestyle practices, and it will take time and a number of policy prescription and the commitment of all of us here in this House in order to cauterize and to change those trends. But the benefits are worth it. Madam Speaker, the economics of sustainability of this public health response cannot be solely to put more money into curative measures, into prescription drugs. We will never have enough. And this is where I want to make the point which I want my colleagues to take note of. I want to look at the National Health Fund, the most critical functionary in public health, and to look at the expenses over time. A close look at the budget of the National Health Fund shows that costs have escalated by 139% between financial year 15 and 16 and financial year 21-22. 4.6 billion in 15-16 and 11 billion in the year 21-22. And this is adjusted for COVID expenses. So, Madam Speaker, over that 7-year period, we have seen an escalation of costs. The additional projection for the next 3 years, which I've asked the health economists to give an indication based on where we're coming from, based on the trends, suggests that we will need another 30% or so increase over that period. 2023, 12.75 billion, 2024, 13.39 billion, 2025, 14.6 billion. At this rate of demand and cost increases to treat the over 720,000 Jamaicans benefiting from the NHF and counting based on our sick profile, this critical entity will need approximately $40 billion over the next 3 years, or risk being able to address the needs of Jamaicans suffering from some sort of illness, the majority of which is lifestyle-related choices that we make. The foods we eat, lack of physical activity, and not knowing our health status. Madam Speaker, sick Jamaicans from lifestyle practices feature prominently these escalating costs. And again, this is worthy of note. In 2020 to 2021, the NHF spent $1.275 billion on hypertension drugs, compared to $940 million over the 2014-2015 period. In 2020-21, the organization spent $1.411 billion on diabetes, compared to $887 million in 2014-2015, a 59% increase. Madam Speaker, rising health costs are not just hitting us as a collective, as taxpayers, but it's also hitting us as individual householders, eroding our disposable income. In fact, the economic impact of rising health costs is absolutely devastating and projected to get worse. Over the 2020 to 21 period, Jamaicans spent $2.384 billion in NHF co-payments on drugs to treat high blood pressure, compared to $1.46 billion in 2014-2015. So it's not just about the taxpayers and the NHF and the capacity to provide it. To the extent that you have to co-pay, those costs are going up and hitting Jamaicans where it hurt. This is a 62% increase just for one illness. Jamaicans also spent a staggering $1.575 billion on drugs for diabetes for 2020-2021 period, when compared to $862 million for the 2014-2015 period, an 82.6% increase, Madam Speaker. Madam Speaker, I introduce us to this narrative, these facts, because I think there is a real need to think about how we can reduce these costs for Jamaicans, many of whom are at risk of impoverishment due to ill health and the associated cost. In other words, Madam Speaker, we must review, we must reform, and we must find a way to renew, a better way. Madam Speaker, I want to further make the point by looking at cost of pharmaceuticals that the NHF has to purchase. And I'm just taking out 10 of the critical pharmaceuticals. There was an increase in the price of these drugs, Madam Speaker, between 2017 to 2022. 8 of the 10 drugs under consideration had price increases of more than 100% over the review period. Examples of the variation in commonly used pharmaceuticals include paracetamol, 785% increase, dextrose, 5% in normal saline, 87% increase, and morphine powder, 117% increase. Madam Speaker, this is absolutely unsustainable. We must review, we must reform, and we must renew. How do we do so? That is the real challenge, Madam Speaker. So we have a few options. We either reduce the benefits to the over 720,000 Jamaicans who are likely to need medicines or curative services and cannot afford to pay in the private sector. Or we change our funding model to reflect a more sustainable approach to financing the health sector. Or use policies and laws to change our lifestyle to improve our health profile and ultimately reduce the cost, both to individuals and to the collective. Madam Speaker, the answer is likely to be a combination of all of the above. What is clear is that healthcare costs are rising rapidly, and access can only be granted if financing is available. Madam Speaker, I think we all should know by now that healthcare is not free. We all pay one way or the other. The question is who pays, how they pay, and how much they pay. It is an issue we must tackle frontally in the coming years. I know, Madam Speaker, I don't want to be the minister. So may I ask, why am I raising this? I don't want to be the minister to climb the tallest tree in the jungle and to scream out, wrong jungle. I don't want to be that minister. I want to be the minister that sees the train wreck up ahead and say, change course to avoid that train wreck. That is what this government is about. It is about correcting problems, and that is what we are intended on to. So it's important to call attention to this. It is time to restructure the health system to achieve a more sustainable financing mechanism, and to do so in a way that ensures efficiency and accountability of existing expenditure, as well as a greater proportional contribution to reflect the increased demands on the system. We also need to determine how this restructured health system is to be financed. In the coming months, Madam Speaker, I intend to unveil a discussion paper, ministry paper, on sustainable financing options for our health system, and embark on a series of consultations within government and the country, as well as with our multilateral partners around healthcare financing. This is a follow-on, Madam Speaker, on the Green Paper on a national health insurance plan that was tabled back in 2019, which was not pursued as desired due to the priorities of COVID. Madam Speaker, I have appointed Dr. Damian King, an economist and executive director of CAPRI, who was the chair of the National Health Insurance Working Group, which led to that Green Paper, to lead the national discussion on the current challenges we are facing with health financing and implications for poverty and the economic and social advancement of Jamaicans. Dr. King is an economist. He's very good at modeling challenges, and I believe he, as well as a support team, can bring to bear a discussion, a frank discussion, which I honestly believe the country needs at this point in time. The goal here is to achieve greater public understanding of the challenges of healthcare financing and implications for each of us as individuals, to consult with local and multilateral stakeholders to explore health financing options, and to assist in the advocacy that is necessary to ensure a more sustainable health financing model. Madam Speaker, I turn to the principle, or a principle of primordial prevention, which is linked to cost. We have spent a lot of time on curing, and we are critical of our inability to provide the medicines. Well, one way to do so is to avoid wanting those medicines. Health is not just about our ability to provide prescription medication, Madam Speaker, hospitals or health centers. It's not just about what the government can do, rather it's about what we can do for ourselves. And I want to repeat that. Madam Speaker, it is impatient of debate that our health starts with us. It's the foods we eat. It's rest, it's relaxation, it's physical activity. It's about how we configure our society to encourage health-seeking behavior and to nudge people into healthier lifestyle practices. If we accept this principle, I urge us today, Madam Speaker, and I'm appealing to the legislators in this House, to see policies and laws relating to health care in a much wider context around prevention rather than just cure, and around lifestyle practices rather than prescription medicines. Yes. We must promote consumer awareness as we encourage taking personal responsibility and discourage unhealthy practices, particularly those who are potentially addictive and destructive. While we support the fundamentals within our society around freedom of choice, we should also recognize the collective burden we bear as a country for choosing to consume excess salts, sugars, fats, tobacco, or abuse alcohol. When we do this, we develop a sick profile that becomes a burden to our friends and families and to the public health system at large. The connection, Madam Speaker, must be made. Yeah. Madam Speaker, and we will continue to develop policies this year around creating that awareness and hopefully nudging consumer adjustment for sustainable health care. I'd like to urge all of us here to subscribe to that principle of primordial prevention and use policies and laws within the wider socioeconomic context to combine behavioral and clinical sciences to achieve a healthier society. Take obesity in our children as a case in point, Madam Speaker. Madam Speaker, our children between the ages of 0 to 12 years, the Global School Health Survey states 65% between 13 and 17 years were overweight, 26% were obese. We have to curb this trend. This year, we will seek to table and to launch, this is myself and my colleague Minister of Education and Youth, new policies and laws around food options in our schools through the soon-to-be implemented school nutrition policy to keep our children healthy and over time help them to develop habits around consuming more vegetables, drinking more water as opposed to sugary drinks. The policy proposal has passed through the stages of internal consultation and is to go before Cabinet as a green paper, Madam Speaker. Madam Speaker, we will work to guide and mandate, in some cases, our school cafeterias to prepare healthier options for our children. Yes. We must help our children to develop healthier habits, and the school environment, Madam Speaker, is the best place to start. Yep. This is what we talk about when we talk about prevention. We must make the link between the cost of sickness and the need to avoid or at least delay sickness. And these are the actions that we need to take. Madam Speaker, our sugary drink restriction in schools, which I note was criticized recently in one publication, and there's good reason why there would have been some challenges. The 2-year absence of face-to-face, the recent resumption of classes. There's an inspection that is now taking place by the parish health offices among all schools. The Minister and I are involved in that process, and once that is completed, we will again resume strict instructions and enforcement around ensuring that the sugary drink restrictions in schools are maintained, are established and maintained, Madam Speaker, and that's a commitment that we are making here today. Additionally, now that schools are reopened, we will also see another collaboration with the Ministry of Education and Youth, which is the rollout of the Jamaica Moves in Schools program to get our children active as part of their wellness program. The Minister of State in the Ministry of Health and Wellness, the Honorable Juliet Cuthbert-Flynn, will lead this initiative, and there is nobody who can lead this initiative better than her. So we look forward to that. And I say to all the schools, look out for Juliet at a location near you, somewhere in Jamaica, because she's going to hit the road. Huh? I will join her sometimes, but I can't keep up with her. That's a challenge, right? Again, I urge us today as legislators to work together to respond to this crisis being faced by our children. It is a crisis because invariably, it is inevitable. If we allow them in that captive space to develop habits that are going to be destructive, it is just a matter of time before they need the NHF.
Yes.
And the NHF may not be there or may not be able to help them because they are so advanced with their particular condition. We need to act now. And legislators, I call on you to support it in the Parliament, but also support it in your constituency. I want to also issue a call to private sector food suppliers. Remember I told you, Madam Speaker, I'm an advocate this year, and I don't care if I offend people. And I know I didn't make a lot of friends when it came to the sugary drink restriction in schools. But I want to issue an appeal. Don't supply products that are against policy to school cafeterias if you know it is against policy because you want to achieve sales or for whatever other reason. In other words, you must see your role in this arrangement, which is to protect the future of our country, to protect our children. I want to go further. Start to reformulate, to create and provide options for our young people, for our children in the school environment. In fact, the new food and school nutrition policy that's coming is going to have restrictions on certain things. It is better to get acquainted with that now, and we are prepared to sit and talk, so that in the future our children have the options that are nutritious, so that we live true to our obligation to make them into adults who are healthy. Madam Speaker, we continue to reset our policies and laws to create a more healthy and conscious citizen. The discussions around the consumer right to know what is in their foods will continue this year with stepped-up advocacy around finding a simple and consistent way to read labels and know what amount of salt and sugar and fats are in your food. The Cabinet, rightfully so, took the decision last year under the guidance of the former Minister of Industry, Investment and Commerce, Minister Shaw, to approve front-of-package labeling. We have not yet, however, decided on what type of front-of-package labeling to promulgate. I want to say, Madam Speaker, that discussion will take place this year. I certainly will be working with the current minister, with the respective teams, to try and find a solution to this. What cannot happen, and I want to say to the food manufacturers and distributors, is that any front-of-package labeling is ideal, and that we could have multiple front-of-package labeling to give advice on foods. That is a recipe for confusion in the marketplace. Yes. And it's either we have it to provide a useful guide to consumers in terms of what they are going to choose, in terms of what is in the food that they exercise the right to buy, or we don't have it at all. And so I say, let us sit, let us have a discussion, let us work together, because I believe consumers will appreciate having that kind of clarity, and it would help us to live true to our obligation to give consumers the information that is required. Madam Speaker, there are other things that are coming that are of importance to cut our sick profile and the cost of treatment. This year, we intend to tackle the destructive impact of tobacco consumption. Tobacco consumption, whether first or second-hand smoke, kills 8 million persons each year, and the cost to the public health system represents billions of dollars to treat. In fact, tobacco is the second only to hypertension as a cause of mortality worldwide. This cost is borne by all of us, not to mention the pain and suffering, Madam Speaker. So, Madam Speaker, over the last year, a lot of work has gone into a comprehensive tobacco bill that has been placed at committee stage, and I'm happy to report that we are well advanced in that process, and included in the recommendations that will be captured in the new legislation, restrictions on marketing tobacco products, prohibiting the sale of tobacco products to children, and restrictions on the development of advertisements targeting children within our society. Expansion of the prohibitions to include use of electronic nicotine delivery system, such as e-cigarettes in public spaces. I'm particularly keen about that because in our school system, We have observed a trend that our students are now using this electronic cigar, looking like a pen and a pencil. And it is corrupting them in more ways than one, Madam Speaker. So I look forward to the bill being very strong on that, the legislation, and support for reducing dependence. The legislation will, I believe, significantly manage the risk of tobacco consumption, both directly and indirectly. And I want to use the opportunity to thank my colleagues and the Parliament for the work that we have done over the last year. And I expect over the next month, 6 weeks maybe, to table the comprehensive bill. And I urge my colleagues to move quickly to pass this bill for the protection of the Jamaican people and to reduce the cost of treatment. Madam Speaker, trans fats are another major risk factor for personal and public health. Trans fats or trans fatty acids are a major source of cardiovascular disease such as heart attacks and strokes, the leading killers in adults today. Trans fatty acids are found in fast foods, baked food goods, fats, oils, and shortening, and have been deemed so dangerous to the public health and significant contributor to healthcare costs that most advanced countries in the world and our major trading partners, the US, Canada, and in the case of the UK, a voluntary agreement, have restricted and outright banned trans fatty acids. And so, for those who say that we have to keep it because our major trading partners have it, this is not one where we can find an excuse for. If we are exporting to those markets, we can't use it. Yeah. If it's not good for them, it should not be good for us, although it should be the other way around, Madam Speaker. Madam Speaker, the time has come to move for the elimination of industrial trans fats in our system, in our food system, and we have started that process. We conducted a study, the National Health Fund and the University of Technology, on trans fats in our foods. Among the key findings in the study are that trans fats are found in 117 of 296 food samples. That's 39.5% of commonly consumed foods in Jamaica. These findings must now be infused in the overall engagement of the public around knowing the content of their foods. And we will begin in the coming months by inviting private sector stakeholders, manufacturers and distributors to present and discuss the findings. So we're not taking an adversarial approach in terms of giving manufacturers an appreciation as to the presence of trans fat. In fact, the initial discussions we hope will be private. But I think it's important that we begin to sensitize the critical stakeholders as well as sensitize the country around the damages that trans fatty acids have on their health and the cost associated with that, and hopefully over time move towards the elimination of industrial trans fats. Madam Speaker, we have also concluded a sodium study, or almost concluded a sodium study. A recently conducted study to provide local data on salt sodium consumption found that 2/3, or 67% of Jamaicans 15 years and older, consume more than the recommended amount of sodium per day. The recommended amount of added sodium for adults is less than 2 grams per day. For persons who are hypertensive, less than 1.5 grams of sodium is recommended as the daily intake. Again, Madam Speaker, part of our role to inform consumers as a basis to influence health-seeking behavior is to expose this information. And we are intending on completing that study, making it public, and then hopefully have a dialogue over time around how we can influence a change in consumption of excessive sodium. Madam Speaker, these issues are part of the broadening scope of public health to address personal wellness, to contain cost, and to improve human development. This is how I started. And these are examples of why we need to support a broader perspective, a broader definition. Health is not just about hospital beds, as important as that is. Health is about life. It is about how we live within our environment, how we treat with ourselves. And if we want longevity of life and quality of life, then we have to broaden the perspective. And as legislator, it has to begin with us. So I challenge all of us here today to recognize it. Madam Speaker, the other element of prevention is community health care. And I want to really pay tribute to our primary healthcare team. You know, during the heights of the COVID pandemic, we were often criticized for not doing things the way North America does it, for example. And what was absent from the conversation was that our health system is structured very differently. So in North America, and I respect their system and their arrangement, they utilize significantly private players like pharmacies to deliver things like vaccines and other forms of responses to COVID. And while that is important, one of the primary reasons why they had to and why they are trained to is because they don't have a primary healthcare system that we have. Our system is very different. We have 325 health centers across Jamaica. In fact, the ratio of mileage to access a health center is approximately 10 miles from the population. We have thousands of doctors and nurses on the ground. They visit homes, they deliver babies, they provide guidance and advice. And indeed, I would attribute a significant part of the COVID response on the ground to that primary healthcare team. And I really want to pay tribute to them. I am happy to announce, Madam Speaker, that out of the adversity of COVID, even though it started before, we are now embarking on a program of reforming our primary or community health care, the most significant reform in 44 years since 1978. This will include an upgrading and networking for telehealth services of over 130 health centers, and that has started, to include telemedicine and electronic record capabilities and the use of digital technology to support continued education and a review of the clinical guidelines, as well as enhanced diagnostics. There will be a rollout of a new chronic care model for management of NCDs that will provide more curative services to reduce the backlog in our hospitals. Madam Speaker, today I table this document in the House, which is Primary Healthcare Reform for Jamaica 2021-2030. And so I'm not going to spend a lot of time on it, only to say this contains all the details. Very difficult work done by the Chief Medical Officer and her team, and I want to recognize her and commend her for it. This is a legacy project, and it is a project that will mean all of us very well, the next generation. And the reason why I raise it and emphasize it is because it is part of the prevention mechanism. Because these are the people who are going in the schools. They are going in the homes. They are telling you, cut back on the sugar, cut back on the salt, long before you reach at the hospital. And so we are now embracing it, expanding it, adding technology to it, and hopefully over time, we'll have a much more primary healthcare response that is more effective.
Dr. Tufton, just for a moment, I noticed you say you have tabled. I haven't seen it, or is it going to be circulated? There's no.
It should be.
I'm not sure.
Should be circulated. It will.
Good.
Yeah.
I'm just ensuring, because I think it's important, and that is here and it is circulated, because it hasn't been. If it's going to be tabled, it will be later, but if it's here and can be circulated, that would be fine.
Thank you, Madam Speaker, and I apologize for that. Madam Speaker, I want to turn now to critical infrastructure, because even while we lament the escalating costs, I want to say for the record, this government has spent more on public health than any other government in Britain. So, we're talking to the future about what needs to happen, and there are some serious conversations that need to take place, but it should never take away from the sterling record of Andrew Holness and this government for the work and the support that has been done in public health. Madam Speaker, one of the key components of the public health system is the infrastructure that provides the framework within which healthcare services are provided. In 2019, I tabled the CAPEX 5-year plan, which highlighted the most significant investments in health infrastructure since independence, Madam Speaker. Despite the challenges of COVID-19, we have started on that journey, and this year, the government is committed to an investment of over $5 billion to support the achievement of the objectives of this particular target, Madam Speaker. Let me go through just a few of the large infrastructure projects that are intended to right-size public health to match some of the deep challenges that we face around our sick profile. Madam Speaker, Cornwall Regional Hospital, and I know that has been my Achilles heel. And I see my colleague across this floor there. I got word from my intelligence on the ground that he'll be visiting that institution tomorrow. And I told them on the ground not only to take good care of him, to take him to lunch after. Because I know he's a good man, and I know he's going to take an objective assessment, and I know he's going to report back to me first, probably. Sorry.
Madam Speaker, the member's time for speaking has been expired. I now ask for a suspension of the standing order to allow the member to complete his presentation.
The question is that the minister be given sufficient time to complete his presentation. Those in favor? Those against? The ayes have it. Minister, or seat belts are on.
Thank you very much, Madam Speaker. So, Madam Speaker, just an update on Cornwall Regional in preparation for your visit, but more so for the country. I'm pleased to report that we have completed Phase 1 and 2A at a cost of some 1.3 billion, and Phase 2B has commenced, expected to cost some 1.7 billion Jamaican dollars. And Phase 2B is aimed at remedial work or structural, to deal with structural defects that were present in the building. This will include the strengthening of structural beams that had begun to deteriorate and the rehabilitation of the other support systems to make the building sound. So remember, you go into the basement where we had to remove the chimney, that was the original design, and you will see when you go significant reinforcement work, steel work and other things happening. That's the Phase 2B, which we hope will be completed. It is on time, on schedule. The Ministry has also received Cabinet approval for the use of design and build for the implementation of the final phase, Phase 3. So that discussion is now taking place, and we will see that final phase leading to the restoration and reopening of the hospital. Madam Speaker, I agree that Cornwall has been a real challenge, and I really sympathize with the people in Western Jamaica. Given the learning curve that we have had to travel on this project, we have strengthened the overall quality assurance function in the project management by contracting a US-based commissioning agent firm that will support or has been supporting the project management unit to ensure value for money and timely delivery of the project. And I think it's working out. I mean, I'm prepared to say that for the first time, this is over the last 3-4 months, I am comfortable that Cornwall is on a track to be rehabilitated and to be restored the way it ought to be. And it has taken a while. It has taken a while for me to say that, because I must tell you, I don't want to go into it, but there are so many issues around the experience of firms to do this kind of work, the project management issues, the relocation issues. I mean, it is a classic case study that I believe all of us should study as to what lessons to be learned to put in place a preventative maintenance arrangement. In the interest of transparency also, Madam Speaker, I have also appointed a multi-stakeholder group including the St. James Chamber of Commerce and the Western branch of the Jamaica Hotels and Tourists Association to review periodic updates and to provide a citizens' oversight body to this project. The chairman of the committee is Dr. Jeffrey East, and I want to thank Professor Archibald McDonald, who wished not to continue serving, who before that was also chair of an oversight committee. Thank him for his services. So there is a team on the ground. The project management meets with that team. They tour when they desire, and so they keep abreast as to what is happening, and I do meet with them from time to time. Madam Speaker, the Western Children and Adolescent Hospital is another big project. 250-bed Western Children and Adolescent Hospital. Some delays due to COVID, However, the Chinese embassy here in Kingston has assured me that work will begin this year. They are estimating around June. The facility is estimated to cost some 5 billion Jamaican dollars, and this year we have allocated 100 million. We are doing very little work, just on the ground, ensuring that there's access to water, to road, to the site, electricity, that sort of thing. And we do expect that that facility will come on stream, or at least begin construction this year. What that means, Madam Speaker and colleagues, is that Western Jamaica, Montego Bay, St. James the Parish, is slated to have the highest concentration of hospital beds anywhere in the Caribbean, and the only adolescent and children hospital in the Caribbean. Bustamante goes up to 12. This one will go up to 18. And so we look forward to that day, and we believe over the next few years you will see that progress going forward. I have said it started with former Prime Minister Portia Simpson-Miller, but we took the baton and we ran a very fast lap to get it up and running, and then came COVID. And then we have been challenged by that. Another big announcement, which is worthy of note as our commitment to building out infrastructure, is UHWI, University Hospital of the West Indies. This hospital, Madam Speaker, will see the most significant infrastructure expansion in over 50 years. A very important piece of infrastructure, Madam Speaker. A 6-story tower to include adolescent psychiatric, surgical and intervention, diagnostic, along with trauma and urgent care services. Madam Speaker, this is estimated to cost some 31 million. That's the design for the facility, which is almost completed. The externals are complete. They're doing the internal design. This year, we have allocated resources to relocate the ring road and to clear the spot where the construction will begin. And hopefully over that time, the designs would have been completed so we can break ground for next year. Now, this is a very important institution. It's regional, it's teaching, building capacity, but it also serves a large cadre of Jamaicans because of the concentration of specialist services. University Hospital of the West Indies slated for a major overhaul, Madam Speaker, a commitment to our intention to build out healthcare infrastructure. But bigger than that is Spanish Town Hospital. Yes. Madam Speaker, in my last sectoral presentation to this Honorable House, I mentioned the investment that were being made through the US $50 million IDB project, and I want to thank our partners at the IDB for building out this very important project. In November of last year, I presented in the foyer of this House the designs for the 3 hospitals and 10 health centers that will be financed under this loan facility. Today, Madam Speaker, I am pleased to advise that the tender for the Spanish Town Hospital will be in the public domain this month, May 2022. Madam Speaker, based on the IDB procurement procedures, it is anticipated that we should have a contractor by the end of the latter part of the calendar year, and work should commence, if not the end of this year, then early next year. Now, this is like game-changing for the parish of St. Catherine and for the country. And what you're seeing there is not a Photoshop version of what it will look like. That's the actual design of the 6-story facility. The facility will boast an accident and emergency wing with ambulatory and ambulance bay, triage and consulting rooms, patient wards, among other things, lounge and lunch areas, a radiology department, a pharmacy and outpatient department, a surgical floor, patient wards, together with a basement area that includes staff parking, as well as a sky bridge. We'll have a sky bridge, Madam Speaker. You can walk across from one part to the next and you don't touch the ground. That's modern infrastructure. Madam Speaker, I am proud of this because I tell you, outside of the work to secure the funding, the team led by the permanent secretary, successive permanent secretaries, but this one in particular, has worked hard to assemble the project team, and it's a lot of work. What I'm prepared to say to the country is that the money is in place, the designs are in place. The challenge now is just to ensure that we implement on time, on budget, for the benefit of the people of St. Catherine. That's the new Spanish Town Hospital. Madam Speaker, then there is the issue of equipment. Madam Speaker, in 2019, I outlined to Parliament the need to provide support for the health facilities to not only support diagnostic work, but to develop a program for development of purchase of equipment to support investments for clinical management of patients. Now, let me break it down to be as simple as possible. The truth is, too many Jamaicans have been going to hospital, and they have to stay in a hospital bed because there is no CT scan, there is no X-ray machine, yes. There is no diagnostic equipment, yes. Not to mention the pain and suffering that they have had to endure. So a year and a half ago, we introduced a program where we outsource that. And the reason why they don't have it sometimes is not that we don't purchase. It's because upon purchasing, we do not have a maintenance arrangement in place. Yeah. So the first time it needs servicing, and these are complicated equipment, it is pushed in a corner, or it is providing less than optimal service. Yeah. We had to find a way to fix that. And this year, we will embark on a program that will not only begin to spend over 2 years, some $4 billion on replacing diagnostic equipment in our hospitals, all type A facilities having an MRI and CT scan machine. That is one. All type B facilities have a CT scan machine, and all hospitals having an ultrasound machine and X-ray machine, just to name the critical ones, Madam Speaker. Beyond that, though, we will also be exploring other options of procurement, with the lease option being a favored option. And you know, if you look around the world on these complicated diagnostic equipment that are so essential to treatment, Madam Speaker, you will realize that a lot of arrangements involve leasing. And leasing basically means leasing from a firm that provides a full package. So gone will be the days when you have downtime from breakdowns without having the support of that technical team. We will therefore look at public-private partnerships. It's being done now, and more will be said on this in the months to come, Madam Speaker. I want to turn to human resources for health, Madam Speaker. Our healthcare workers are indeed our best asset in the public health system. We have over 23,000 workers in the system. They keep the wheels turning, responding to patient needs, even with limited resources. They also represent our most significant vulnerability as the world tries to grapple with the shortage of healthcare professionals, with mass overseas recruitment now a standard feature of filling vacancies. You know, Madam Speaker, while we support the mobility of labor, I do believe that there is a debate to be had in this post-COVID period around the future of work, and work, Madam Speaker, in the healthcare space. The Minister of Finance and the Public Service has announced that the government's intention to address anomalies in compensation package. And we welcome that, and I believe we all should welcome that. However, I would humbly suggest that this solves only part of the problem when it comes to healthcare, where there is a global scarcity of health skill sets and wealthier first world countries paying multiple times in terms of salaries, ease of access to work permits, even permanent residence, to recruit healthcare workers from countries like Jamaica, developing countries. It is going to place us into a significant challenge in the coming years. As we build out our infrastructure to improve the work environment and offer security of tenure to replace contract employment, Jamaica must also provide global leadership on the issue of scarcity of labor and the need for global collaboration around training and flexible contracts to promote cross-border service delivery of healthcare services. So, Madam Speaker, one of the lobbying initiatives that I intend to take on, and I will chair the Commonwealth Health Ministers meeting in London next month, go to the World Health Organization shortly after that in Switzerland. I do intend on Jamaica's behalf to lobby for greater attention in collaborating around human resource build-out and training and the hardships that small countries like Jamaica will face from the mass recruitment of larger, more industrial countries of our professionals. Not to say that people cannot move, but if we're going to have a lopsided movement, it's going to make all of us vulnerable, as COVID has shown. And I think the time has come for us to have a conversation around that. Madam Speaker, we must start the process of adjusting for the future of work in this challenging healthcare space. One initiative I've spoken to in the past and would like to update this Honourable House on is the granting of prescriptive rights to our advanced nursing practitioners. Madam Speaker, I know not everybody is in agreement with this, and some of the doctors in particular. But in many countries, advanced nursing practitioners have the capacity to prescribe up to a certain level. And more often than not, they are the only one in the deep rural parts of a health center. They are the only ones who are exposed to the patients. There is no doctor there. And while consultation can take place, it has to take place remotely. And I think the time has come for us to look at that as part of the future of work, Madam Speaker. So, Madam Speaker, we have formed a committee chaired by Professor Eldemar Shearer, including the Medical Council Registrar, Professor Howard Spencer, Nursing Council Chair, Pharmacy Council Chair, Family Nurse Practitioner, Nurses Association of Jamaica President, and our own Chief Nurse, Mrs. Patricia Ingram Martin, to establish this committee to address registration and prescriptive rights for advanced nursing practitioners. The committee has started to work, examining training requirements, including continuing medical education associated with nurse practitioners prescribing, soliciting the views of key stakeholders in relation to nurse practitioners being registered, allowed to prescribe, and views on what to prescribe and when. Madam Speaker, the next step will be to discuss the legislation that is needed, including completion of the proposed amendments to existing legislation, as well as areas such as training, continuing education, and telemedicine. The committee will widen the discussion and finalize recommendation on prescriptive rights. Madam Speaker, as we build out our restructured primary healthcare model, we see significant benefits to enable our advanced nursing practitioners from training to be able to support patient care by writing prescriptions up to a certain level, particularly in remote areas where we do not have doctors to do the same. Madam Speaker, the future of work will require more division of labor without compromising the quality of care. This is an example of that, and we must move speedily to complete this process. It's about review, reform, and renew, Madam Speaker. Madam Speaker, it has not been lost on me to turn to another area, care and compassion. Not been lost on me as Minister that there is a need to confront the issue of good customer service in our hospitals and our health centers. In 2018, I proposed and began the implementation of the Compassionate Care Program with the aim of training frontline staff in good customer service, as well as enhancing the waiting areas in our health facilities to improve patients' experiences. Despite the improvements, I am still not satisfied that we are doing enough to deliver care with empathy and with compassion. I'm going to call it as I see it. I think we can do better, even though many are doing well. This year, we will again sensitize the public to the Patient Charter of Rights and Responsibilities. This is a charter that has been established for some time, and we need to ensure that it becomes the rallying theme within our health facilities, so that patients know that they have rights, but they also have responsibilities, Madam Speaker. We will reintroduce the public to the complaints mechanism, which is a structured mechanism through which reports can be made regarding any abridgment of patient rights once they attend any health facility, whether it be hospital, health center, or even head office. In the interest of strengthening this, Madam Speaker, a new feature will be introduced this year. We will engage the services of a BPO firm to manage all toll-free lines to receive and track complaints and provide the reports to the complaints mechanism that will also be strengthened to follow up, monitor, and report directly either to the Permanent Secretary's Office or to my office as minister. Madam Speaker, we are hoping that through this adjustment, gone will be the days when the phones will ring unanswered when someone has a concern and wants to lodge that concern, and that we will fix a problem that arises as quickly as possible in order to correct any discrepancies, misunderstandings, or even injustices to the extent that they exist within patient-customer care. We understand and appreciate that the hospitals and health facilities are challenging environments where patients and health practitioners must deal with complex issues that raise tension and gets the nerves going. We understand that in many instances, persons must deal with difficult life decisions and are provided with information that upends their entire life experiences. That's the nature of the hospital environment. Madam Speaker, these facts are the daily realities of persons who work within the system. And in as much as there is a requirement for compassion to patients, there must be reciprocity. As such, it is important in promulgating the Patient Charter of Rights and Responsibilities that the responsibilities of the Charter will also be enforced, and there will be a zero tolerance for the abuse of healthcare workers by patients who believe that if they do not do what they want in the time that they want, they should resort to abusive language, threats, or even violence. So it goes both ways. It has rights, but it also has responsibilities. Madam Speaker, I want to quickly address, and I'm winding down, the issues of the side effects of COVID. Very important. We have taken note in public health that while the response to COVID has been life-saving, has done a lot to protect the health and the wellness of the Jamaican people, that the responses, particularly the non-clinical responses, came with side effects, for want of a better term. Yes. It created inconveniences, it created concerns, it created downtime. And in public health, we have assessed the response over time as tabled in the document that is before you, one of the documents, to come up with a plan to deal with those side effects this year, even while we continue to battle COVID. Our non-clinical measures and restrictions on school and stay-at-home curfews, particularly for older populations, have come with the consequences of loneliness, anxiety, motion deprivation. When our hospitals were overburdened with COVID-19 cases, we had to suspend certain clinics and elective surgeries, leaving many Jamaicans to wait for clinical services that had much pain and suffering to them, and even making their conditions worse. And I think it's important to recognize this. But importantly also, our nurses and doctors have had to work consistently over time, many suffering burnout and fatigue. And they continue to work despite the challenges that they have had to face over that time. This year, we will attempt to address 3 areas of focus as we attempt to recover from the side effects of COVID. We will design and implement special programs to address concerns around mental health, surgery backlog, and staff welfare. I want to look at a few of them. Mental health. Madam Speaker, even before COVID-19, mental health was a significant issue in our society. It continues to be an issue of national priority, with many Jamaicans suffering in silence due to the stigma associated with mental illness. I'll give you some examples. In Clarendon, for example, there was a 68% increase in total psychiatric discharge from the Maypen Hospital over the April 2021 to January 2022 period, when compared to the 2-year average over a similar period. There was also an increase in the number of people reaching out on the ministry's mental health and suicide prevention helpline 888 New Life, or 888-639-5433, which was launched in October 2019. Between October 2019 and December 2020, the line received 888 calls. Between January and December 2021, we saw a 53% increase in the number of calls received, as the numbers ballooned to 1,648. At the Queen Sophia Women's Counseling Center, also in St. Catherine, there was a 172% increase in new patient sessions in 2021, Madam Speaker, moving from some 624 to 1,698. Madam Speaker, among the mental health issues dealt with through the line were emotional distress, depression, suicidal thoughts, stress, as well as anxiety, Madam Speaker, bipolar disorder, substance abuse challenges, intimate partner relationship issues, grief, panic attacks, and trauma. There are also cases requiring intervention, among others, Madam Speaker. Madam Speaker, our response is to focus on mental wellness. In fact, I don't like to refer to mental illness because there's a stigma around mental illness. All of a sudden, everybody starts to move away from the conversation for fear that they be seen in a sort of traditional mode of what a mentally ill person is. And it's the biggest barrier to taking on this challenge. So we're going to focus on mental wellness. It begins with the recognition, however, I'm speaking to all of us in this house, that it is normal to be mentally unwell at some point in our lives. And that we all, yes? I sit beside you not under normal circumstances, so I know when it is normal, it is normal. And we all could benefit from therapy sessions in mental wellness. Yes. It is not, if it is not anxiety or panic attacks over an incident that is near and dear to us, it may be depression from a lingering issue that just doesn't go away, doubt or fear about the unknown. If there is one thing, Madam Speaker, that COVID-19 did to us, it was to induce fear and uncertainty, which threatened to destabilize our state of mind. Yes, yes, and I don't think anybody can deny that. I don't think anybody can deny that. And the way to tackle mental health or mental wellness is for us in this house to recognize and perhaps be bold enough to say that at some point in our life, our mental state was compromised. Yep. And how we overcame that. I don't expect that any of us in here are still inconsistent with it. I don't expect that. I don't expect that. But we should accept it. I'm looking at you now. I'm looking at you now. So I reiterate and I say so seriously, Madam Speaker, that the key to mental wellness is to accept that we can be mentally unwell. Yeah. And I'm going to put up my hand and say yes. I've had periods of mental anguish. I have had periods of mental anguish. I've had to withdraw and contemplate and find ways to cope. Yeah. And I challenge all of us to put up our hands and say the same thing, because guess what? You may actually save somebody's life who is suffering in silence and needs that kind of attention. Madam Speaker, during this year, we must do the following. We must promote better understanding and acceptance that mental health issues can affect all of us. And let me add that a specific effort will be made to enhance mental wellness in our schools. A lot of times, the Minister and I have spoken about this. Lots of things that you're seeing manifesting itself in schools. The deviant behavior. I'm not saying you mustn't apply punitive measures where people knowingly step out of line, because discipline is critical. But psychosocial support and evaluation is fundamental in trying to determine what are some of the root causes and trying to address some of these root causes. We are going to also support the concept and techniques of mental wellness as part of our coping mechanism. And we're going to thirdly mobilize an army of Jamaicans dubbed holistic health officers who are trained or to be trained in psychosocial support techniques for community and institutional interventions to assist Jamaicans who may just need to be heard and to give critical support to them to overcome any manifestations of mental health challenges, which whether it is dispute resolution or re-engaging the school environment or the work environment. And we're going to be providing a mechanism for more specialist care in the public and private sector for persons with more serious mental health challenges. So, Madam Speaker, the new mental health wellness program will build on an already established program called Reach Out Rangers, which was launched during COVID-19, and will involve collaboration with a wide cross-section of persons and institutions, including the Jamaica Red Cross, school guidance counselors, the Jamaica Psychiatric Association, and the Jamaica Psychological Association. Madam Speaker, I have asked Senator Dr. Sapphire Longmore, a psychiatrist by training, to coordinate a small group, working group, on this mental wellness outreach program. And herself and her team will provide greater details in the weeks to come. But we are working on the final touches of this program. Essentially, what this will mean is that we'll have different levels of support in the society. There will be a community outreach, visit persons, listen to them. If they have issues, encourage the kids to go back to school, provide guidance if there are concerns, all the way up to having an appointment with a psychiatrist, if that is required. And I think this is going to be an important intervention, particularly because of the impact on the mind of the COVID experience. The other is surgery backlog, Madam Speaker. Since March 2020, many hospitals have had to suspend the normal processing of elective surgeries, would have resulted in the extension of the length of time that persons wait. Persons have been waiting for a year and a half for particular procedures. Our checks reveal that the longest waits are for the following procedures: cataract, oral cancer, sinus cancer, thyroid cancers, arthroplasty, undescended testes, just to name a few. Madam Speaker, our special intervention this year, called Code Care, will seek to do an additional 1,000 surgeries over the next 10 months to clear up as many of the longer backlog cases as possible. We will seek to address this by engaging the following techniques. We're going to be working with the diaspora, and that discussion has started, of healthcare professionals who visit Jamaica for special surgery sessions to provide a more efficient arrangement and access to hospital facilities and target elective surgeries with the longest wait. We will do so in conjunction with the Ministry of Foreign Affairs and Foreign Trade and our missions overseas, as well as to our National Healthcare Enhancement Foundation. Madam Speaker, many people don't know, but under normal circumstances, outside of before COVID, every month, many health missions come to Jamaica that we accommodate. They come to do particular procedures, very ad hoc in terms of where they go and what they do. What we are planning to do this year is to try to structure that group, working with our missions overseas. And some of those discussions have started. We believe if we organize sufficiently, we can get them to assist. But we're also providing $300 million to repair, where necessary, our operating theaters to operate more efficiently and longer hours. So you'll see some more night shifts. And we are partnering with private sector health facilities to provide surgery and recovery spaces to augment existing facilities. So the private hospitals, to the extent that they can play a role with some of these procedures, are going to be re-engaged. Madam Speaker, Code Care project will be planned and executed by the Office of the Chief Medical Officer. I want to quickly turn to e-health, Madam Speaker, another significant addition to building out our health infrastructure for better service delivery. Last year, I spoke about the IDB Finance Health Information System, which will revolutionize the way we administer care to patients using technology. Today, I'm happy to report that we have commenced implementation as follows. The M-Health application was completed and launched in June 2021. The app will be a component of the chronic care model that is currently being designed. The M-Health application is a mobile app that will allow the user to exchange information with a physician about the management of their chronic condition. The app has three main components, namely education, health promotion, and guidance, and allows the user also to record their vital signs. These are just some of the features. There are several others, Madam Speaker. We unveiled, the Honourable Prime Minister visited also the open house at the Pegasus, where we showed off. You were there too, my opposition counterpart this technology. In fact, I will say that this is going to be the most significant and transformational technology platform to deliver of public health services in the country. And indeed, it is one of the few in this region. Once it works, and it's always an issue of implementation, the challenge, but the resources are in place, it will allow for remote access through technology, telemedicine. It will allow for records to be transferred electronically, so people don't have to now go into these file rooms and search for paper-based records. There's just so many components to it. It allows you to track your own health status by inputting data and therefore know if you are at risk of some form of ailment. Madam Speaker, we have commenced. The cable and wireless were the recipients of a competitive bidding process. The ICT managed network services that they are now implementing in 100 health centers. And this contract was valued at some $1.56 billion. That contract has been awarded, and they are now working to put in the hardware and the networks within those particular health centers and hospitals. Madam Speaker, the third is staff welfare. And I'm happy to announce that yesterday, Cabinet has signed off on a submission to recognize our healthcare workers for their sterling contribution to the COVID-19 response. This recognition will take several forms. I am pleased to announce that the month of July this year will be recognized as Healthcare Workers Appreciation Month. The aim is to salute our healthcare workers for the sterling service in the fight against COVID-19, a fight that continues, let me add, but we have 2 years to demonstrate that they have done well and continue to do well. Healthcare workers from across the island will be recognized through a series of events and activities at the parish, regional and national levels. These events and activities include church services, family fun days, and award banquets. Madam Speaker, Wednesday, July 13 will be declared Healthcare Worker Appreciation Day, and we invite all stakeholders to join in celebrating our national health heroes. During the month, one of the highlights will be the unveiling of a monument in honor of healthcare workers who have died as a result of being on the line of duty to fight COVID. In November, the Mary C. Cole Award of Jamaica, a special award will be given to healthcare workers for their contribution to the pandemic. So, Madam Speaker, there are a series of activities, and we will give better details around that. But that, again, is a recognition that I believe the country should all appreciate and support, to recognize our health workers and their contribution. Madam Speaker, I come to the conclusion. As I approach the end of this presentation, I want to say, as a member of the health team, we have, over the past 2 years, and certainly over the last year, attempted to marshal ourselves and the country through one of easily the greatest challenges that we have had to face in terms of public health. We have attempted to optimize the opportunities at the same time for renewal, well, for assessment or review, for renewal, and for reform. And this was all in the interest of creating a better healthcare system, a better Jamaica, and certainly by extension, given the nature of this pandemic, a better world. As we continue to confront the challenges of COVID, Madam Speaker, another issue, our vision for Jamaica 2030 is a manifestation of our collective understanding that without good health and good provisions in healthcare, there can be no sustainable development. Healthcare is an investment, Madam Speaker. And as a country and as a people, we must pivot in our thinking to ensure that our investments have the greatest return in ensuring a positive, resilient future for generations to come. This is non-negotiable and a social and economic imperative as we re-engage the social contract that involves all citizens in the new paradigm for healthcare. Madam Speaker, I thank you for your understanding and indulgence. Colleagues, I thank you for the same. And as we move forward, I pray that God will bless all of us and we will recognize healthcare not just as hospitals and hospital beds, but also nudging Jamaicans into health-seeking behavior for better quality of life, for longevity, and for a more resilient health system. I thank you.
Madam Speaker, I think I would like, on behalf of the Parliament, to thank the Minister for his wonderful presentation and contribution to the sectoral debate. Madam Speaker, I now ask for the debate be suspended until tomorrow, Wednesday, May the 4th, when we will continue.
Members, the question before the House is that the sectoral debate be suspended until tomorrow, Wednesday, May 4th. Those in favor?
Aye.
Those against? The ayes have it.
Madam Speaker, I now ask that the items, announcements and notices of motions given orally be recommitted to enable the tabling of the documents mentioned by the Minister of Health in his presentation today, and for the Minister of State and the Minister of Finance and the Public Service to table the Customs Tariff Revision Amendment to Resolution 2022 on behalf of the Minister of Finance and the Public Service, respectively.
Members, the question before the House is that there's recommittal of the items, announcements, notices of motions given orally, questions and answers to questions. Those in favor?
Aye.
Those against? The ayes have it. Announcements.
Also laid on the table of the House today are the following 4 documents supplied by the Ministry of Health and Wellness. Vitals, a quarterly report of the Ministry of Health and Wellness dated April 20, 2022. COVID-19 at a glance, using data prepared as at April 24, 2022. Highlights of key initiatives 2021-2022 and primary health care reform for Jamaica for the year 2021 to 2030.
Notices of motions given orally. Minister of State.
Okay. Yes. Thank you. Madam Speaker, I beg to give notice on behalf of the Minister of Finance and the Public Service that at the next meeting of the House, he will move the following motion. The Customs Act, the Customs Tariff Revision Amendment Resolution 2022, whereas Section 5.1 of the Customs Act provides that it shall be lawful for the House of Representatives from time to time by resolution to impose import or export duties on customs upon any goods whatsoever which may be imported into or exported from the island, and to revoke, reduce, increase, or alter any such duties, and to provide for the importation or exportation of any goods without payment of any customs duty thereon. And whereas the House of Representatives, by the Customs Tariff Revision Resolution 1972, imposed the import duties of customs set out in the first schedule of the resolution and provided in the fourth schedule to the resolution a list of commodities ineligible for conditional duty exemption. And whereas it is desirable to amend the first and fourth schedules of that resolution to accord with the revised common external tariff of the Caribbean community based on the 2022 edition of the Harmonized Commodity Description and Coding System approved at the 53rd meeting of the Council for Trade and Economic Development on November 24, 2021. Now, therefore, be it resolved by the House of Representatives as follows. 1. This resolution may be cited as the Customs Tariff Revision Amendment Resolution 2022 and shall be read and construed as one with the Customs Tariff Revision Resolution 1972, hereinafter referred to as the principal resolution and all amendments thereto. 2. The principal resolution is amended by A. Inserting immediately before the first schedule the notes to the first and fourth schedules set out in Part 1 of the schedule hereto. B. Deleting the first schedule and substituting therefore the first schedule set out in Part 2 of the schedule hereto. And C. Deleting the fourth schedule and substituting therefore the fourth schedule set out in Part 3 of the schedule hereto. Madam Speaker, members are encouraged to view the schedule already attached, which is also a part of the resolution and has been tabled before you. Copies have been circulated to the members for their perusal.
Questions and answers to questions?
Madam Speaker, the time being 3:15 p.m. 3:15, time being 3:40, which is beyond the 3:15 p.m. I now move that the House be allowed to receive and answer questions at this time.
Madam Speaker.
No, just have to approve it first.
Members, the question before is for us to approve the item of questions and questions to be recommitted past 3:15 p.m. Those in favor?
Aye.
Those against? The ayes have it.
Madam Speaker, I'm just seeking an assurance from the acting House Leader. There are questions that were due to be answered in my name on the 29th of March. And I have sought and asked when these questions will be answered. I know we're in the sectoral debate, but I don't think that prevents these questions from being answered. So we're almost a month late, and I would ask the acting House Leader to use his position to get the Minister to answer the questions tabled in my name.
Madam Speaker, I'll have a word with the Minister, and hopefully by tomorrow some indication as to when it will be answered. Okay?
Madam Speaker, I beg to give notice that at the next meeting of the House, I will ask the Minister of Education and Youth the following questions.
Madam Speaker, it is not contemplated for us to do any further business today. I therefore ask that the House be adjourned until tomorrow, Wednesday, May the 4th.
The question for the members is that the House be adjourned for sitting of the House tomorrow, Wednesday, the 4th of May at 2 p.m. sharp. Those in favor? Aye. Those against? The ayes have it. This House is now adjourned.
And me, so will you?